Welcome to Legal Nurse Podcast. I'm Pat Iyer, and this is our 9th year of producing shows for legal nurse consultants that are heard all around the world. I'm delighted that you're with us today for this session and for all of the future sessions that we have for this show. Coming up in our next LNC Success online conference, taking place February 27, 28, and March 1, 2025, you will have an opportunity to get support, to get knowledge, to have networking experiences, and to refresh your business. We're going to focus on a lot of foundational content to help you move forward in your business, get more clients, make more money, and avoid expensive mistakes. You can sign up for that conference at lnc.tips/February 2025 virtual. I would love to see you there. Now, let's get on to the show. Welcome to Legal Nurse Podcast. I'm Pat Iyer, and I have a guest today who is an author. She's a nurse scientist. She's a nursing professor, and she is a trauma burnout expert. She has a heart-centered, integrative approach to healing and is the author of a book called Nursing Our Healer's Heart, a recovery guide for nurse trauma and burnout. She's a speaker, author, consultant, and I've had a delightful time with her, talking with her in preparation for this podcast about how trauma and burnout affect legal nurse consultants. Our guest is not an attorney, and she's not a medical doctor. Her name is Dr. Lorre Laws, and she has her doctorate in nursing. Lorre, welcome to the show.
Thank you, Pat, so much for having me. I'm just delighted to be on your show and really share this information with your community. So thank you.
You are welcome. We're looking forward to having a chance to talk about a topic that I think forever I've heard about, or at least feels like since I've been in nursing for a long time, the concept of burnout and burnout syndrome affecting nurses in a wide variety of clinical areas is something that we're familiar with. And yet I bet if you pushed us up against a wall and said, please define nurse burnout syndrome, we would be saying, is there a definition that you'd like to share with us?
Yeah, it's interesting. The term burnout syndrome was first introduced in 1970. And so there is a much needed update to make the definition more relevant today. So the World Health Organization, which is a pretty standard interpretation of burnout syndrome, defines it as occupational stress that is not effectively managed. And they consider it solely an occupational phenomenon, as if we have one body that we use at work and another body that we use when we're not at work. So it reflects sort of that old reductionistic kind of empirical definition rather than kind of this more widely accepted integrative or whole person view of the term burnout. But that's what we're working with right now on the world. And I just checked before I came on the show to make sure there were no last minute updates. And that's what they have up there.
Well, I'm thinking about you could become burned out as a parent of a toddler, for example, and that would have nothing to do with occupational stress, but I recall those years in both of my sons' lives as being pretty difficult.
Yes,
and there were times
yes.
that I thought, is this ever going to end?
Yeah. I had three children in 4 years, and I was fortunate to be able to, I had 2 babies in 12 months, hence the delay for the third. I was fortunate to be able to stay home with them in those early years. And I refer to those times as the best and hardest work I've ever done, because there is no break. And really, you can get a sense of burnout when we get imbalanced in any way in our body, our mind, our spirit, the essence of who we are.
Well, carry us a little bit further from 1970 into the development of a term called nurse-specific traumatization. That is a term that I know will be new to many of our listeners. What does that mean? Nurse-specific traumatization.
Yeah, it's such an important concept, and I think really it's so important for your audience to know that we have now in nursing. It's hot off the press. Dr. Karen Foley at Purdue University recently published the middle range theory for nurse psychological trauma. And so what this does is that it acknowledges that what we are experiencing in our professional roles is not just stress. Not while there is stress, that is true. And even there is chronic stress, that is true. But when the stress meets a certain threshold, it becomes trauma exposure. And that is unique to each of us because it depends also on our own personal history with trauma. So if you look at the American Association of the Colleges of Nursing and you look at their position statement on trauma, the position statement is that we as nurses should assume that every person on this planet has experienced some form of trauma. Now, it is not our job to uncover it or have anyone relive it. That's not the point, but to be sensitive to that fact. And so in my research, as pertains to burnout, I was like, well, hold on a minute. Nurses are a subset of every human on the planet, right? We are a subset of everyone. And so we, in our professional roles, should also assume, as colleagues, as a profession, that every nurse similarly has been affected by trauma. And Dr. Karen Foley in her middle range theory calls that nurse specific trauma, which kind of falls into two categories. There's avoidable and unavoidable. And I don't know if you want me to kind of unpack that further, but I'm happy to do so.
Sure.
Yeah.
Let's talk
So
about
so
avoidable and unavoidable.
yeah, so the and I think this would be really helpful too to understand through the lens of a nurse legal consultant, is we all, as we recall our nursing education and training, we all knew that what comes with our profession, with the art and science of nursing, is the suffering that is inherent. We are caring for people oftentimes in one of their most traumatic experiences, right? So we get some training in our nursing curriculum and whatnot regarding vicarious and secondary trauma. And that's when, we suffer along with those in our care because we are providing, heart-centered, patient-centered care. And we feel that whether we're in a courtroom or in a conference room or at the bedside, we still feel all of that. And then we are also well trained in the second type of unavoidable nurse trauma exposure is trauma from disasters, any myriad of natural disasters or pandemics, that sort of thing. And we do have training. We know how to, if there were an earthquake here today, and I were in a clinical setting, I would have some training to draw upon to help me with that. So that's what Dr. Foley might classify as unavoidable trauma exposure. And it does take a toll on the body, but we have tools and resources that we have learned. It maybe only for a snippet of nursing school, but there, it is covered in the curriculum. And then we get to the whole other category, which is this avoidable trauma exposure. And there's several categories of that. The obvious one that comes to mind is workplace violence. There's all manner of violence that nurses are exposed to. whether it's physical assault from the patients. I mean, I recently spoke at a national nursing conference, and there were 200 nurses in the audience. And I asked them, as we were kind of unpacking all of this together, like, how many of you, by a show of hands, how many of you, like me, have experienced being hit, punched, bruised, battered, spat on, hair pulled, scratched, or had bodily fluids thrown at you? How many of you have, by show of hands? Now, I had tasked my assistant who was with me at this presentation to please count the number of hands that went up, right? And what happened is we had 190 hands go up, and all she could do were count the hands that did not go up.
Mm,
All right, so workplace violence, and that would also include lateral violence like bullying and incivilities of any sort, gaslighting, hazing. These practices. It's kind of this generational trauma that gets transmitted from, that nurses eat their young kind of expression that we always hear. That's really the legacy of unintegrated nurse trauma being transmitted from one generation to the next, because we're not aware of it. And we don't have the tools that we need to really heal that. And that's part of what my work is. So we have the workplace violence, and we have the historic, and those are, we can call those both unavoidable, because we can't change the past, right? We can't go back and unwind 220 plus years of the history of nursing. But what we can do is we do have an opportunity to change how we become aware of and manage this generational nurse trauma and the workplace violence. So that's why they're classified as avoidable. And then another one, and this is kind of a big one, is when we have system-induced trauma. This is where the healthcare system itself is a vehicle of trauma exposure. So a great example of that one, kind of going back to the 190 nurses in my audience who had their hand raised, attesting to being physically assaulted in their professional role. When you go to report that, following the chain of command, following your organization's policy, and you go in and you have the meeting with your superior or your manager or whomever, and almost every time the first question is, what could you have done to prevent that? Right? That's adding another layer of trauma on top of a traumatic event. If I'm coming into to my charge nurse's office and I have the beginnings of a black eye, that is a gaslighting behavior. It's a blame the victim, right? But it's so embedded in our policies that sometimes we don't see it for what it is. And that's why I'm so grateful for this middle range theory. Another big one that nearly every nurse that and I've talked to thousands through my research and through my dissemination of the research, is insufficient resource trauma. And I think this is what's happening a lot for our legal nurse consultants, is that nurses don't have the resources they need to practice within the full scope of their license, or they have dangerous staffing ratios, or they're being floated to units where they don't have expertise, and so this would be what's called insufficient resource trauma. It's like, it's like going to a forest fire with a water bottle and trying to put out the forest fire, right? You don't have the tools that you need to be successful. And that is a trauma exposure. You're in the role to help people and practice, and you don't have either the physical resources or, in my case, I herniated 3 discs in my lower back significantly because I worked at a hospital that had 4 wings on the 4th floor, med surg, and there was only one Hoyer lift for all 4 wings. And I had a bariatric patient that started going down, and I did my best, and the patient landed safely, and there was no patient injury. But I now live and have for decades with severe chronic back pain. as a result of this. So this would be, from my own lived experience, an example of insufficient trauma, resource trauma. And then another one, and I classify, this is the last one we'll talk about, but it's what's called second victim trauma. And it's really something that our legal nurse consultants encounter. And this is where the adverse events, the near misses, and the sentinel events can come in. Oftentimes, we suffer, even if we have made an error, I mean, I have made minor errors in my practice, and boy, I tell you what, they're still with me today, even though they happened decades ago. You still feel them in your body. So that's second victim trauma, because the patient may have been exposed to harm or a threat to their safety or quality of care, right? Things in that nature. And but oftentimes when the root cause analysis is done, we find that it was a system error. Sometimes nurses make errors. We're human, and that happens. But a lot of times we have we get to the root cause, and we find we have a policy or a protocol that was needed to be updated or revised. And so the nurse still carries the shame and guilt, even if they weren't actually at fault. And if they were at fault, then it's especially, the shame and guilt that they carry. And so this gives us, as nurses and as legal nurse consultants, it gives us a framework to really look at these cases in a trauma-informed manner. And we have now we have theoretical framework. There are studies that will continue to be done and published as this middle range theory finds its way out into the world, that can really inform our evidence-based practice in any setting. So that was a whole lot to unpack, Pat. I hope I did it in an economical way. I know we have limited time.
So many thoughts went through my head as I was listening to you, Lorre, and starting with the fact that many of us went right from high school to nursing school without any work experience. There are certainly people who have nursing as a second degree, but for many people, it's the first occupation that we choose. And when you talk about the trauma that we experience, layered into that is the fact that we were 18, 19, 20, 21 years old at the time that we were exposed to birth and death and everything in between.
Yeah.
Whereas our contemporaries who were in a 4-year college program or a 2-year associate degree program, were walking down the halls, deciding who they were going to date next week, and certainly not exposed to that level of shock to the system. I can remember some vivid incidents from nursing school. One in particular where my patient died in the chair after I got her up out of bed, and I couldn't figure out why she wasn't responding to me, and it was time to put her back to bed. And she was turning quietly cold and pale. And I thought, wow, did I miss the clues as to why she wasn't responding to me? That level of changes and shocks and experiences that we went through helps to understand why we resort to Black humor, or inappropriate laughter is a better way to term that rather than give it a label of Black humor, but something that's incomprehensible to people outside the field of healthcare who think, how could they just finish that code and then go into the break room and they laugh hysterically about something that somebody said as they're burning off their tension?
Yeah.
Those things struck me as you were talking. And I know that for the people who are exploring legal nurse consulting, some of whom listen to this podcast, they will relate to the insufficient resources factor that you brought up, because legal nurse consulting looks very attractive on the outside. You don't have to lift heavy patients, as you and I both did. You get to sit at a desk. Attorneys are just sitting, waiting for you to contact them, which is this myth that exists in the field. And it seems like it's a stress-free business, working with attorneys in a nice environment, whether you're in your home or you have an office setting. Tell us a little bit about how the burnout and the traumatization can impact us as entrepreneurs. Before we continue.
Hi, my name is Crystal Keller. I've been a legal nurse consultant for over 30 years. Pat Iyer is one of the most well-known and respected pioneers of legal nurse consulting. She has not only been the past president of the American Association of Legal Nurse Consultants, but also she has a successful business and has written and contributed to many textbooks, including the Legal Nurse Consulting Principles and Practice. Most recently, I have had a chance to attend her virtual Legal Nurse Consulting Success Conference. And what I'd like to say is a couple of things. Number one, the fact that it was virtual made it very convenient, very affordable. You didn't have to worry about taking time away from either your business, your work, or your family. And also, it was very affordable, so you didn't have to worry about traveling and hotel expenses as well. What I found in the conference is that this conference, the content ranged for anywhere from new legal nurse consultants who are just starting or thinking about starting this journey, all the way through experienced legal nurse consultants. It varied anywhere from the fundamentals of building your business all the way through marketing, expert witness testimony, and beyond that. I found that the speakers were very dynamic and the entire conference was very interactive, which was helpful. We had breakout sessions. We were able to review a case and critique. We also discussed expert testimony and what to say and not say and how to avoid the traps on the stand. So I feel that as though this was one of the most wide-ranged conferences that I had been to in quite some time. Like I said, it's anywhere from, new legal nurse consultants all the way through experienced. So I encourage you, if you have the opportunity to attend any of the legal nurse consulting success conferences, I would highly recommend it. I believe it would be something that you would get so much from, and it's a great networking opportunity as well.
Well, it's such a great question because, I think when we're making career pivots, of which I've made several myself, initially we have kind of this, the grass is greener mentality because we don't know what we don't know. We haven't experienced what we haven't yet experienced. It's natural. And it's just part of the transition process. But, my son is an attorney. And so I watched him go through law school and start his practice. And it is a very demanding profession. The legal profession is one that is very demanding in ways that are very similar to traditional bedside nursing. In that you are working with clients and attorneys, all of whom are having, the clients arguably are having some of the toughest challenges in their life, and that gets visited upon the legal team, which includes and is not limited to the legal nurse consultant, right? And so it is a different type of pressure cooker, if you will. And so really, I think it's so important for all of us as humans and as nurses of all roles, and particularly legal nurse consultants, is to understand that so many of the symptoms of burnout are actually immediate or delayed responses to trauma. So I did a whole symptom cluster analysis because I'm a scientist and that's what we do. We like to go through the evidence base and analyze things. And so I got very curious as I was working with nurses in all manners of roles that were struggling, and they weren't responding to traditional, what we might call burnout self-care approaches. And so I started looking at the symptoms across, physical, emotional, mental, existential, and relational domains, right? So kind of all aspects of our lived experience, and found that there was tremendous overlap between burnout and nurse-specific trauma symptoms. So I think the first thing is really to be aware that if a person is feeling burnt out, or if you're in a legal case where it's being asserted that the nurse was burned out and therefore a mistake happened, perhaps that would be a scenario, that it's not always just burnout. We have a whole middle range theory that we can draw upon, and my research, which is presented as though we're having a cup of tea together in my book, because I wanted to make it accessible to all the nurses, is to look beyond that 50-year-old burnout narrative and be curious. Be curious. I wonder if this is nurse-specific traumatization. And if so, how does that impact the case? Or from your own professional perspective and experience, like I'm having these symptoms. I'm not sleeping well. I'm eating too little or too much. My digestion is off. I'm feeling anxious. I'm feeling depressed. I am exhausted and I can't even get off the couch to go do all the fun things I had planned this weekend. These types of symptoms that emerge. And sometimes we get into this pattern of blaming and shaming ourselves, like, well, I should, that should word, the S word, the other S word, right? But being curious about that, like, wow, I wonder if maybe I'm experiencing, some trauma response here, because a different approach is needed for, what I might call trauma-informed self-care, right? And
Yeah,
understanding how to go about that.
I am sure that that's something that defense attorneys see a great deal. The plaintiff attorneys have little exposure to the registered nurses who become defendants in a case. They may take their deposition or cross-examine them at trial, but the defense attorneys see the toll that being a defendant in a case takes on a healthcare provider, both nurses and doctors.
Yeah.
The way that being sued and the second victim that you referred to earlier can disrupt, interfere, throw a bomb into a person's life. It is fairly common that nurse defendants leave the jobs, they want a fresh start somewhere else. But every time they have to go through this legal process in the 3 to 5 years that it takes to resolve a medical malpractice case, every time their attorney calls them, every time they have to prepare for a deposition, every time they have to look at a report that has come in, they are reminded over and over again that they have a target on their back. They have been named as a defendant. And that's really what the legal system focuses on. It doesn't focus on, did you make the mistake because you were fatigued? Did you make the mistake because these two drugs have very similar names and very similar labels, and it's easy to mix them up? What counts in the legal system is the ultimate outcome. What did you do?
Yeah.
Regardless of how you got there.
And that's why it's so important for each of us, and especially for legal nurse consultants, to really understand the language of your autonomic nervous system and vagus nerve, and how to insulate yourself from these trauma exposures, because all of that which you just described, Pat, are trauma exposures, not only for the nurse who is having to defend themselves, but also for the legal nurse consultant who is supporting the case and interacting with the legal system, and law professionals and lawyers who aren't always compassionate, aren't always person-centered in their communication and behavioral styles. And so really learning and understanding how to insulate ourselves and keep ourselves in what is called our window of tolerance, where we're in nervous system regulation. Right, because that's when we can really see the big picture of things. But if we get in a very stressful or a trauma exposure context, what happens is that we kind of go into a sympathetic response, and so we can't see the big picture. Our just like our actual visual field narrows, so does our cognitive field in terms of how we can employ reasoning and judgment becomes very narrow also. And so, we think of kind of our sympathetic nervous system as this saber-toothed tiger kind of response. You're either running towards it to fight it, or you're running away from it for safety. But if we kind of take that and put that into the context of legal nurse consulting, it's like, yeah, there's a lot of opportunities for our midbrain and our autonomic nervous system and our vagus nerve to signal that we are, there's a threat, an implied threat or a perceived threat to our safety. And that has a whole sequela of physiological responses. And so understanding how to kind of navigate that in a way that keeps you extremely effective in your practice and not at risk for burnout or traumatization, because you can insulate yourself and navigate it in a really healthy manner. And that just translates to all good outcomes for the legal nurse consultant, right? We can be more effective and we can handle more cases because they're not grinding us up. As I have seen even my son who's not in the medical field, but just the legal arena is very challenging at times. Yeah.
It is, and there are many attorneys who comment about a lack of civility that exists in the legal field that used to be present, where attorneys would be much more courteous to each other. In wrapping this up, because it's very clear that we could go into depth on this subject, I would like to know if you can leave us with a practice that we can integrate into the way that we react in stressful situations. A 30-second practice. I understand you've got one right up your sleeve that you're ready to share before I ask you our final question about how our listeners can find out more about you, your publications, and your services. So
thank you, Pat.
Practice.
Yeah, so what I have developed what emerged out of my research is that nurses of all professional roles, including legal nurse consultants, we need something we can do while we're at work. Most people, when we think of self-care, we think of something that we do later on the weekend, in the evening. I'm going to take a hot bath, I'm going to go for a walk, right? And that's not helpful in the moment, right? The nervous system, the physiology, our bodies need help in staying regulated throughout the day. So I coined the term microdoses matter for this 30-second practice. And it's one that can be done. I recommend doing it at all the transition gaps in the day. Like, for example, putting on your seatbelt, brushing your teeth, sitting down to return an email, walking into the attorney's office as you're walking to the office. So wherever there's a little 30-second transition, getting supplies out of the supply room, anything like that. And there's 4 steps to this, and they're super easy. The first one is find a private or safe space where you can be for 30 seconds. So you don't have to run all the way out to the parking lot to your car. Sometimes a stairwell, the restroom qualifies. I call it my potty practice, right? So the restroom, nobody's gonna give you any grief if you step into the restroom for 30 seconds or a minute, as the case may be, right? So wherever that may be, an empty conference room, I've used all of those places. So that's just to give your nervous system a sense of, okay, I'm safe right now, right? Okay, lets the nervous system settle. So first step is safe space. Second one is ground and center. And I don't know if your viewers, I'm holding, like I always have on my person a little grounding stone. I also wear earrings, which count. I wear a necklace that counts that I can just gently touch. Something in my pocket, a bracelet, maybe the fabric, a scarf, anything that feels grounding. And if you don't have any of those objects on your person, always, always, always you have your feet with you. And so put those on the ground and really feel the earth beneath you. Like drop all the way down, drop your awareness all the way down into your feet or into your grounding stone or into your necklace or earring or whatever you're just going to touch for a moment to like bring you back into the body. All right. So first step is find a safe space. The second one is ground and center. The third one, and this is, I mean, they're all important, but this is the mission critical one. This is where we signal safety to our autonomic nervous system. Because when we're under stress or having a trauma exposure, from the perspective of our autonomic nervous system and our midbrain, we're not safe. Right, like our prefrontal cortex recognizes that there's no saber-toothed tiger, but the more primitive physiology does not. And so a couple of things to do. I like to give myself a little bear hug if it's appropriate, if I'm in a quiet place, and that gives that nervous system a container. And it really is helpful in that way. Sometimes if I'm in a sympathetic state, I'll just sway in a chair back and forth for 10 seconds, 5 or 10, and just like to let that energy discharge. And there's a whole host of other ways that I have over 100 practices in my book, but we're not going to go through all of them. So there's 2 to get you started. And this one's just give yourself a bear hug is the one that most people find it really effective because it gives that container, that sense of safety. It's very physical. It's very palpable. We all know what it's like to be hugged in a dear and calm way. And so we can draw upon that. So we have safe space, ground and center, signal safety to the nervous system. And the fourth one is to put both hands over your healer's heart, your why, for what matters most in your life, including your professional role, and connecting back in to the love that each of us are and the love that is available for us 24/7. We don't have to do anything. We don't have to earn it. It's just simply there. We just have to open it to receive it. So do you want to do a quick one in 30 seconds with me, just so we can demonstrate that it can be done in 30 seconds?
Absolutely.
All right. Here we go. All right. I'm in a stressful workplace. Okay. I find that the conference room is open. I'm walking to the conference room. I'm reaching for my grounding stone. I'm touching my necklace, or I'm putting my feet on the floor. I'm just feeling the connection to these grounding objects as I drop down into my body. I'm going to sway in my chair because I feel like I'm really stressed in my nervous system. And then I'm giving myself a bear hug just to contain my nervous system as I put both of my hands over my heart. And just remember my why for everything that matters most, which is always love. And there you have it. And
right.
yeah, and so you can do variations of this as you're even walking down the hall, right? So you adapt these 4 steps to whatever is context appropriate for where you might be. I have done this walking into a patient room. I have actually been in very heated meetings where nobody knows that I'm taking a deep cleansing breath. I'm connecting to my feet on the floor. When I touch my necklace for a moment, they just think I'm adjusting it. Nobody gives it another thought. And if you can't put both of your hands over your healer's heart, just in your mind's eye, do that. Right. So as many times throughout the day as you can weave that practice, what that helps do is it helps build nervous system resilience. And it's how you can protect and insulate yourself from the high stress that often appears in our professional roles and or the trauma exposure. So I'm hoping that is helpful.
I appreciate that, Lori. That's called Micro Doses Matter. And I shared with our viewer at the beginning of this podcast, the name of your book. Would you like to share it again, as well as how people can find out more about what you have to offer?
Oh, thank you so much. So this is my first book, and I'm really, really excited I wrote it for our profession, our international nursing profession. It's called Nursing Our Healer's Heart, and it is a recovery guide for nurse trauma and burnout, but also kind of, if you're not there yet, then all the more reason to read it so you don't get there, right? And in conjunction with that, I founded a nonprofit organization called the Halen Academy. And Halen is the old English word for healing, which is a prominent theme in the book. And there I offer healing from trauma programs for the general public and for nurses. I have a 12-week program there. Everything, how to order the book. Right now we are, you can check my website at drlorrelaws.com, and I'm going to spell that because I have an unusual spelling to my first name. So that's DRLORRELAWS.com. And on my website, you'll find everything. I also have a 5-question assessment that you can take to, if you're curious to see, is like, oh, I wonder, is it burnout, or is it maybe am I experiencing nurse-specific traumatization? And then I send out a tailored report so you can just learn a little bit more, take a deeper dive into some of the topics that we've talked about today. So thank you for letting me share that with your community, and just know all of this is nonprofit work for me, so I'm here to be of service and light and love however possible.
Thank you so much. I appreciate your expertise, the time that you've spent with us today, the way to put some of our experiences into a different light. We've covered that the concept of burnout has been around for a long time. If I calculate that correctly, it's at least 50 years that we've been talking about nurse burnout and how that impacts the profession. And it's certainly something that maintains its relevance as we move forward in changing conditions in healthcare. I'd like to thank also to you, the listener, for staying with us, for watching this podcast on our YouTube channel at Legal Nurse Business, or by listening on the audio channels. Hang on just a few more minutes to find out who's coming up next on Legal Nurse Podcast, and I'll see you on that show. Coming up next, our podcast is going to feature Barbara Levin and I as we talk with you about planning for 2025. Barbara focuses on setting some goals related to customer retention, customer acquisition, types of cases that you want to work on. And then I covered the concept of doing some research on your ideal client using AI. I show you 3 prompts that you can use in ChatGPT that gets to the heart of what your ideal client wants to learn about, which then guides you when you do content creation and you are writing LinkedIn posts or writing blog posts. You know that you're focusing on the frustrations and problems and challenges of the attorney you want to work with. And Barbara completed the program by discussing networking opportunities, taking advantage of chances to make presentations to attorneys and attend online conferences. You'll get a lot of tips from this program, and I encourage you to take notes. You'll get a lot of value. That's coming up next. Planning for 2025. That's it for Legal Nurse Podcast. Thanks for being here. Be sure to get your ticket for our next online conference that's taking place February 27, 28, and March 1. You can get your ticket at the link in this video if you're watching this on YouTube, or if you're listening to this, the link is lnc.tips/February 2025 virtual. Come on and join us. Get knowledge, get support, get encouragement, make new friends, all from the comfort of your home. We'll see you there.